Student, the continuation of the recent lecture. Now the dosage form continuation is there. First one is a dermal topical use. In case of dermal use, the another formulation we have that is called pastes. Pastes are basically ointment having high percentage of insoluble solid we added. The extraordinary amount of particulate matter pastes are less penetrating, less macerating, and less heating than the ointment. Particularly, pastes are good protective barrier when these are applied over the skin, can absorb, neutralize certain noxious chemical before they reach the skin. Like ointments, paste form an unbroken, relatively water. Pastes are the less greasy because of the absorption of the fluid, hydrocarbon fraction to particulate. The are two type of paste. First one is called fatty paste. Secondly, we call non-greasy paste. The dusting powder is also used externally. They have a free flow, very fine powder for external use. These are not used open wounds unless the powders are sterilized. Externally, the another part that is called transdermal patch. The transdermal patch or skin patch, medicated adhesive patch placed on the skin delivers specific dose of the medication through the skin, then it will enter into the bloodstream. The transdermal drug delivery route over other type like oral topical, it provides controlled release of medicament into patient. Commercially available patches are scopolamine for the motion sickness. Plaster. These are solid, semi-solid mass adhere to skin when spread with the help of a cotton or a muslin, a backing material to use. The plasters are having three main types like afford protection and mechanical support. Secondly, furnish an occlusive and macerating action. Third, bring medication into close contact with the surface of the skin. Liniments are the fluid, semi-solid or intent for the application to skin. The liniments are alcoholic or oily solution or emulsion. They are massaged into the skin. The example is counter irritant. Liniment should not be applied to the broken skin. Lotions. Lotions are fluid preparation for external application without any friction. They dabbed on the skin or applied on a suitable dressing covered with a waterproof dressing to reduce the evaporation. Collidin, a solution of nitrocellulose in ether, acetone, or of the alcohol. The basic name of colloidin is pyroxylin solution. This solution is highly inflammable. As solvent evaporates, it dries to a celluloid film. Colloidins also used as a compound wash remover. The presence of acetic acid and salicylic acid in acetone, the collidant base used for the treatment of warts by keratolysis. Paints. These are the liquid used for application to the skin or mucous membrane. The skin paints contain volatile solvent, evaporate quickly, leave a dry, resinous film of medicament. Throat paints are more viscous due to high content of glycerol, designed to prolong contact of medicament with affected site. Aerosol. Aerosol is a physical form of administration. Aerosols are used as a spray as pressurized dispenser. In pharmaceutical product, a packaged in pressurized dispenser is called aerosol. These sprays produce a droplet of 100 micro diameter or it may be a greater. Aerosols act as a surface disinfectant in case of burn or wound dressing. It will relieve the irritation of the bites. Spray on dusting powder also available from pressurized containers. In case of rectal dosage form, in that there are mainly two examples. First one is suppository. Secondly, we have enema. In case of suppository, suppositories are small, solid, medicated mass. These are usually in the cone shape, insert into the rectum or insert into the vagina, where these are melt at the body temperature. Enema is a procedure of introducing liquid into rectum and colon via the anus. The type of anemia, first one is called evacuant anemia. The evacuant anemia used as a bowel stimulant to treat the constipation. The example of the evacuant anemia is a soft anemia or magnesium sulfate anemia. The dose or volume of evacuant anemia is up to 2 liters. They should warm to body temperature before the administration. Second, we have retention anemia. The volume does not exceed 100 ml. No warming is required for that. The retention anemia produces the local effect like the barium anemia is used a contrast substance in the radiological imaging of the bowel. The systemic effect of the anemia, administration of the substance into bloodstream. This may be done by stimulation where impossible to deliver a medication by mouth or such as anti-emetic. The example for the retention anemia, the nutrient anemia contains carbohydrate, mineral and vitamins. Vaginal dosage form, the type is called pessary. The pessary are solid medicated preparation used for insert into the vagina where it may melt and dissolve. Pessary usually having three types. First one is called molded pessary. Molded pessaries are cone shaped, prepared similar way as the molded suppository. Secondly, we have compressed pessary. In this case, variety of shapes and these are prepared by compression manner as the oral tablet. The third one is vaginal capsule. They are similar to the soft gelatin oral capsule, differ in their size and shape. Some vaginal rings are also used as this category. In that, we have first douche. Douche is a device used to introduce stream of water into the body for medical or hygienic reasons. The vaginal rings it contains a polymeric drug delivery device designed to provide a controlled release of drug to the vagina over extended period of the time. The type of vaginal ring, first one is called Famring. It is a low dose estradiol acetate releasing ring manufactured from silicone elastomer. They are used to relieve the hot flashes and vaginal atrophy associated with the menopause. Neuvering, a low dose contraceptive vaginal ring, release the progesterone and estrogen. Intrauterine device. This is also inserted into the vagina. The main use of this device is to birth control and place in the uterus, also called IUD or a coil. In the world, most widely used a reversible birth control. This device will be fitted inside or removed from the uterus by a doctor. Intrauterine device in place the entire time pregnancy is not desired. Depending upon the type, like a single that is approved for 5 to 10 year use. There are two main categories of this device. The main use as a contraceptive device. First one, these devices are inert and copper based device. Second, this device hormonally based device that by working the release of progesterone. Injection is also a route of drug administration. Injection is an infusion method of putting the liquid into the body, usually with a hollow needle and syringe, by piercing the skin to a sufficient depth for the material to force into the body. There are several methods of injections. Few are like intravenous injection, the liquid administration directly into the bloodstream via a vein. The advantage having a one set of fraction is rapid. There are so many type of injection. Few example like intramuscular injection, subcutaneous injection, intrathecal, intraperitoneal or intraaconic. These are the few type of the injection which will be used with the help of a syringe and a needle. In case of inhaler, inhalers are solution, suspension or emulsion of the drug in a mixture of inert propellants under pressure in a aerosol dispenser. Release of dose of the medicament in the form of droplet, the less from the container. In some type, the valve is actuated by finger pressure. In other type, the valve is actuated by patient breathing through the mouth. These inhalers are mostly used to treat the asthma and the other respiratory tract problems. Nebulizer, in other words, we'll call atomizer. Nebulizer is a device by which administration of medication to the pupil in the form of a liquid mist to the airways. These are commonly used to treat the asthma and respiratory tract problem. Nebulizers will be pump air or the oxygen through liquid medicine to turn into a vapor. The nebulizer inhaled by the patient as a general rule, doctors generally prefer to prescribe inhalant to their patient because these are not costly, portable carry, less risk of the side effect. Nebulizers usually reserved for serious cases like respiratory disease or severe asthmatic attacks. Another class of drug dosage form that is called ophthalmic preparation. In the ophthalmic preparation, there are certain eye drops, eye ointments, or ear drops are there. Eye drops are like caline containing a drop used as a vehicle to administer medication in the eye. Depend upon condition, they may contain steroid, antihistaminic, or topical anesthetics. Eye drops do not have medication in them. They have lubrication and tear. The ophthalmic ointment or a gel, these are sterile semi-solid preparation intent for the application of conjunctiva or the eyelid margin. In case of the eardrop, these are the solution, suspension or emulsion of drug installed into the ear with the help of a dropper. These are used to treat ear infection, especially infection of the outer ear or the ear canal. Eardrops also prevent the ear infections. Nasal drop and spray. In this case, drug in solution may be installed into the nose from a dropper of form a plastic bottle. The drug may have a local effect. The drugs which are used as a nasal spray, these are called antihistamine or decongestant. The drug may be absorbed through the nasal mucosa to exert a systemic effect. The use of oil nasal drop should be avoided because there is a possible condition to damage the cilia of nasal mucosa. Some intermediate products are used when we compounding for dispensing the medication. In that, like extract. Extracts are concentrated preparation contain active principle of the vegetable or animal drugs. Be extracted with suitable solvent, concentrate to form liquid, soft and dry extract. Glycerin is also a solution of medicament in glycerol with or without the addition of water. Infusion. These are dilute solution contain readily soluble constituent of the crude drug prepared by diluting one part of concentrated infusion with the 10 parts of water. The concentrated infusions prepared by cold extraction of crude drug with 25% of ethanol. Oxymals. These are preparation in which the vehicle is a mixture of acetic acid and honey. Spirits. These are alcoholic, aqueous alcoholic solution of volatile substance used as flavoring agents. Tinctures. These are alcoholic preparation containing the active principle of vegetable drug. They are relatively weak as compared to the extract. Aromatic water. Aromatic water is also intermediate product, but these are aqueous solution saturated of volatile oil or other substances. The aromatic water used as flavoring agent. Thank you.